Welcome to this video on hepatitis B-associated nephropathy, a kidney disease linked to the hepatitis B virus. We'll delve into what it is, how it develops, its impact on the body, and what can be done about it. Whether you're a healthcare professional, a student, or simply curious, this video aims to provide a comprehensive overview of this important condition. The primary cause of hepatitis B-associated nephropathy is, as the name suggests, infection with the hepatitis B virus, or HBV. While HBV primarily targets the liver, in some individuals, the virus can trigger an immune response that affects the kidneys. This occurs when the body forms immune complexes, which are complexes composed of antibodies and HBV antigens. These immune complexes circulate in the blood and can become trapped in the glomeruli, the filtering units of the kidneys, initiating an inflammatory process and subsequent kidney damage. Genetic predisposition, environmental factors, and the specific strain of HBV involved may also play a role in the development of this nephropathy. The pathophysiology of hepatitis B-associated nephropathy revolves around the deposition of these immune complexes in the glomeruli. When these complexes deposit, they activate the complement system, a part of the immune system that triggers inflammation. This inflammation damages the glomerular basement membrane and the surrounding cells. Over time, this damage leads to proteinuria, which is protein leakage into the urine and can eventually progress to glomerulonephritis and inflammation of the glomeruli. The continuous inflammatory process causes scarring, or glomerulosclerosis, reducing the kidney's ability to filter waste and leading to kidney dysfunction. In severe cases, this can ultimately result in kidney failure. Hepatitis B-associated nephropathy is most commonly seen in regions with a high prevalence of hepatitis B infection, particularly in Asia and Africa. It predominantly affects children and young adults, but can occur in individuals of any age. The exact incidence and prevalence are difficult to determine due to underdiagnosis and variations in screening practices. However, studies have shown that a significant percentage of individuals with chronic hepatitis B infection may develop some form of kidney involvement. Certain ethnic groups may also be at higher risk, suggesting a genetic component to susceptibility. The signs and symptoms of hepatitis B-associated nephropathy can be subtle in the early stages. One of the earliest signs is proteinuria, which may be detected during routine urine testing. As the condition progresses, individuals may experience edema or swelling, particularly in the legs, ankles, and around the eyes. Hypertension or high blood pressure is also a common finding. In more advanced cases, symptoms of kidney failure may develop, including fatigue, loss of appetite, nausea, vomiting, and decreased urine output. Some individuals may also experience foamy urine due to the presence of excess protein. Diagnosing hepatitis B-associated nephropathy involves a combination of clinical evaluation, laboratory testing, and kidney biopsy. Initial evaluation includes a thorough medical history, physical examination, and assessment of kidney function. Laboratory tests typically include urine analysis to detect proteinuria and hematuria, blood tests to measure kidney function markers such as creatinine and blood urea nitrogen, and serologic tests to confirm hepatitis B infection. A kidney biopsy is crucial for confirming the diagnosis and determining the specific type of glomerular disease present. Immunofluorescence studies on the biopsy sample can identify the presence of HBV antigens and immunoglobulins, helping to differentiate this nephropathy from other kidney diseases. Hepatitis B-associated nephropathy is not a single disease entity, but rather encompasses several different types of glomerular diseases associated with HBV infection. The most common type is membranous nephropathy, characterized by thickening of the glomerular basement membrane. Other types include membranoproliferative glomerulonephritis, IgA nephropathy, and focal segmental glomerulosclerosis. Each of these subtypes has distinct pathological features and may present with varying clinical manifestations. The treatment and management of hepatitis B-associated nephropathy aim to control the hepatitis B infection, reduce proteinuria, and slow the progression of kidney disease. Antiviral medications, such as entecavir or tenofovir, are used to suppress HBV replication and reduce viral load. Immunosuppressive therapy, including corticosteroids and other immunosuppressants, may be used to reduce inflammation and immune-mediated damage in the kidneys. Supportive measures, such as blood pressure control with ACE inhibitors or ARBs, dietary modifications to reduce protein intake, and diuretics to manage edema, are also essential components of management. In cases of advanced kidney failure, dialysis or kidney transplantation may be necessary. Prevention of hepatitis B-associated nephropathy primarily focuses on preventing hepatitis B infection. Vaccination against HBV is highly effective and is recommended for all infants, children, and adults at risk. Screening for HBV infection is crucial, especially in high-risk populations. Avoiding risky behaviors, such as sharing needles or engaging in unprotected sex, can also reduce the risk of transmission. For individuals already infected with HBV, regular monitoring of kidney function and early intervention can help prevent or delay the development of nephropathy. The prognosis of hepatitis B-associated nephropathy varies depending on the severity of kidney disease at diagnosis and the response to treatment. Early diagnosis and prompt treatment can improve outcomes and slow the progression of kidney disease. Recent research focuses on developing more targeted therapies that specifically address the immune mechanisms involved in HBV-related kidney damage. Studies are also exploring the use of novel antiviral agents and immunomodulatory therapies to improve treatment outcomes. Continued research is crucial to further understand the pathogenesis of this disease and develop more effective strategies for prevention and management.